with pharyngitis, with tonsillar enlargement, and sometimes there is exudate in the tonsillar region. Other clinical findings may include development of skin rash and edema of the eyelid. بالنسبة للراش يعني about 3 to 15% of patients with infectious mononucleosis develop the rash. The rash is maculopapular in nature, but if the patient with infectious mononucleosis receive ampicillin or amoxicillin during the course of illness, there is increased risk of developing this maculopapular rash in about 80% of the cases. And this rash is immune mediated and usually disappears spontaneously. These major symptoms of infectious mononucleosis usually last for about 2 to 4 weeks. Epstein-Barr virus was the first human virus to be associated with malignancy. شافوا a correlationship between the infection with infectious mononucleosis or Epstein-Barr virus and development of malignancy, which include nasopharyngeal carcinoma, Burkitt lymphoma, Hodgkin lymphoma, and lymphoproliferative disorders. هذا هنا summary of the symptoms اللي احنا حكينا عليها. قلنا the patient usually develop fever and fatigue and malaise for 1 to 2 weeks. This is associated with sore throat and pharyngitis, associated with generalized lymphadenopathy, particularly the anterior and posterior cervical lymph node and the epitrochlear lymph node. There is also abdominal pain, and there is also on examination enlargement of liver and spleen. For diagnosis of infectious mononucleosis, adna certain investigations. Number 1, we can do complete blood picture. If we do complete blood pictures, there is increase in the white blood cell count. Usually it count about 10,000 to 20,000. At least 2/3 are lymphocytes. In the peripheral blood, we can see a typical lymphocyte, which account for 20 to 40% of total number. Atypical lymphocytes are mature T lymphocytes that have been antigenically activated. إذا نسوي مقارنة بين الليمفوسايت العادية والأتيبيكال lymphocyte. الأتيبيكال lymphocyte تكون larger than the normal lymphocyte and it contain eccentrically located nuclei with lower nuclear to cytoplasm ratio. بالنسبة للcomplete blood picture also the platelet count may be decreased. So بالcomplete راح نشوف leukocytosis، راح نشوف atypical lymphocytes بالperipheral blood، والplatelet count راح تكون slightly decreased. بالنسبة إلى hepatic transaminase, there is mild elevation in hepatic transaminase enzyme in about 50% of the cases. حتى نسوي confirmation for the diagnosis, we need serological test for detection of antibody against Epstein-Barr virus. من ضمن هذه الانتيبودي عندنا antibody to nuclear antigen, antibodies to early antigen, antibodies to viral capsid antigen. The detection of IgM antibody to viral capsid antigen is the most valuable and specific serological test for the diagnosis of acute infection with Epstein-Barr virus. هذه الصورة إذا تشوفون النورمال lymphocyte والأتيبيكال lymphocyte مثل ما قلنا it is larger than the normal lymphocyte والنيوكلياي مالتها eccentrically located. For treatment of a patient with infectious mononucleosis نحتاج therapy with high dose of antiviral drug اللي هو acyclovir, decrease viral replication and oropharyngeal shedding, but not reduce the severity or duration of the symptoms. We need also bed rest, and symptomatic therapy are the mainstay of management. Because blunt abdominal trauma may predispose patients to splenic rupture, so it is important to advise the patient and the family against participation in contact sport or athletic activities during the first 2 to 3 weeks of life. لأن إحنا واحدة من الكومبليكيشن السيريس كومبليكيشن بالإنفكشيوس مونونيوكليوسيس والبيشنت ممكن يصير عنده سبلينيك رابتشر، ولهذا إحنا advise the patient and the family not participate in any heavy sports or activity during the first 2 to 3 weeks of illness to prevent this abdominal trauma which may predispose to splenic rupture. Other line of treatment, we can give the patient short course of steroid, less than 2 weeks, and there are certain indications to give steroid therapy in patient with infectious mononucleosis. هذه الانdication when we decide to give a steroid to a patient with infectious mononucleosis عندنا 4 indications. Number 1 إذا عندنا incipient upper airway obstruction، احنا قلنا يصير عندهم enlargement of the tonsils and inflammation of the pharynx, enlargement of the lymph node. This may lead to upper airway obstruction, so we can give steroid therapy to those patients. If the patient's second indication developed decrease in the platelet count or thrombocytopenia. Number 3, if the patient developed autoimmune hemolytic anemia. And if he developed meningitis and convulsion or seizures, this is the 4th indication for giving steroid therapy to patients with infectious mononucleosis. How we give steroid? In form of prednisone. The dose is 1 milligram per kg per 24 hours for 7 days. Then we can taper the dose over the next 7 days. فيصير total duration of treatment less than 2 weeks. بالنسبة إلى complications, there is a lot of complications. قلنا إحنا the most fear complication اللي نخاف منها بالinfectious mononucleosis, the development is subcapsular splenic hemorrhage or splenic rupture, which occur most frequently during the second week of disease. ولهذا we advise the family not to, the patient not participate in heavy sports during this period of time. Swelling of tonsils and oropharyngeal lymph node may cause upper airway obstruction. Other complications here, neurological complication, which include headache, seizures, ataxia, meningitis, encephalitis, and facial nerve palsy. Other complication اللي هي hemolytic anemia. Other aplastic anemia. Plastic anemia اللي هي depression of the element of the bone marrow. 6 thrombocytopenia اللي هي decrease in the platelet count, and there is also decrease in the neutrophil count and development of neutropenia. Other complication here, involvement of the heart in form of myocarditis and also development of pneumonia, and rare complication like pancreatitis or parotitis. All these the complications of infectious mononucleosis. In an infectious mononucleosis produced by Epstein-Barr virus, the incubation period تقريبا 1 to 2 weeks, characterized by fever and malaise and also sore throat. بعدين تبدأ manifestations of generalized lymphadenopathy with hepatosplenomegaly. Diagnosis كنا نحتاج for complete blood picture راح نشوف atypical lymphocyte, وكذلك نحتاج detection of antibody against Epstein-Barr virus antigen. راح نشوف احنا عندنا بالcomplications كدنا they may develop splenic rupture, neurological complication, hemolytic anemia, pneumonia or myocarditis. نجي إلى البوليو viruses. Polio is important viral infection during childhood. The etiology of poliomyelitis, polioviruses are RNA virus, belong to the Picornaviridae family in the genus of enterovirus infection. And there are 3 serotypes بالنسبة إلى polioviruses, type 1, 2, and 3. Polioviruses spread from the intestinal tract to the central nervous system, where they cause aseptic meningitis and poliomyelitis or polio. بالنسبة إلى transmission of the disease, humans are the only known reservoir for the virus. Poliovirus has been isolated from the feces more than 2 weeks before paralysis to several weeks after the onset of the symptoms. The disease spread by direct contact with infected person through pharyngeal secretion or by contaminated feces. يعني the way of transmission of poliovirus is through fecal-oral spread. Usually the virus reaches the intestinal tract, then from the intestinal tract it replicates and reach the central nervous system. In the central nervous system it involves the anterior horn cell and cause poliomyelitis or aseptic meningitis. Clinical manifestation of poliomyelitis أيضا عندنا الفيرست هو incubation period which is about 8 to 12 days and they range from 5 to 35 days. The poliovirus infection follows several courses and 4 important causes for the clinical presentation of poliomyelitis. The first one هو inapparent infection. Second presentation type is abortive polio. The third type هو non-paralytic polio. والfourth type هو paralytic polio myelitis. نجي إلى inapparent infection تقريبا يشكل 90 إلى 95% من الكيسز and cause no disease and no sequelae. يعني معظم الكيسات of poliomyelitis هي inapparent infection اللي يشكل نسبة تقريبا 90 إلى 95% of the cases. بالنسبة لأبورتيف poliomyelitis تقريبا يشكل لنا 5% of the cases. In this type of a presentation of polio, the patient develops fever, malaise, anorexia, and headache. There may be sore throat, abdominal pain, and vomiting. Physical examination إذا نجي نفحص patient is normal. Recovery is complete from this manifestation of fever and headache and vomiting. With duration of the abortive poliomyelitis تقريبا 2 to 3 days. إذا عندنا several presentation. البرزنتيشن الأولى اللي هي inapparent infection. البرزنتيشن الثانية هي الأبورتيف poliomyelitis. يجي إلى البرزنتيشن الثالثة اللي هي non-paralytic poliomyelitis اللي هو تقريبا يشكل 1% of all cases اللي هو presented with sign of abortive polio اللي قلنا هي fever, malaise, headache, abdominal pain may be associated with vomiting. This is presented as well as there is associated pain and the stiffness of the posterior muscle of the neck, trunk, and the limbs. The fourth clinical presentation of polio اللي هو نسميه paralytic poliomyelitis. البرسنتج مالته كلش قليل تقريبا 0.01% of all cases راح يكون the presentation of polio in form of paralytic polio. The paralytic polio cause 3 clinical recognizable syndrome. These are عندنا أول واحد هو spinal paralytic polio، عندنا bulbar polio، وعندنا polio encephalitis. نجي على spinal paralytic polio اللي هو أهمها usually occur as the second phase of biphasic illness. The first phase of illness تشبه الأبورتيف polio اللي قلنا يصير بيها fever, malaise, sore throat, abdominal pain and vomiting. The patient then appear to recover and feel good and better for 2 to 5 days. After that, he developed severe headache associated with fever and there is exacerbation of the previous systemic symptoms. The patient also developed severe muscle pain and there is sensory and motor phenomena like hyperesthesia, paresthesia, fasciculation, and spasm developed during this second stage of spinal paralytic polio. After this manifestation, الفيس الأولى اللي هي fever and malaise وبعدين تبدأ الفيس الثانية of neurological involvement. Within 1 to 2 days, the patient developed asymmetric flaccid paralysis. Asymmetric يعني involve one side of the body or paresis occur. Involvement of one leg is common, followed by involvement of one arm. Initially, the نفحص deep tender reflexes initially hyperactive and remain for short period of time. But after that, reflexes will be absent or diminished reflexes. This is associated with flaccid paralysis of the one leg or one limb. In the spinal form, there is also weakness of muscle of the neck, abdomen, trunk, diaphragm, and the thorax. The sensation is intact. Paralysis of the lower limb is often associated with bowel and bladder dysfunction. هذه كلها الكلينيكال manifestation of spinal paralytic poliomyelitis. عندنا السكند تايب من الباراليتيك poliomyelitis هو قلنا البلبر poliomyelitis. It may occur as a clinical entity without apparent involvement of the spinal cord. The clinical findings of bulbar poliomyelitis include: number 1, paralysis of extraocular muscle, facial muscle, and muscle of mastication. الextraocular muscle اللي يزودها third cranial nerve والfacial muscle اللي يزودها seventh cranial nerve. There is nasal twang to voice caused by palatal and pharyngeal weakness. There is inability to swallow smoothly. There is also bulbar polio accumulation of pharyngeal secretion, which may cause irregular respiration. Absent of effective coughing. There is nasal regurgitation of saliva and fluid as a result of palatal paralysis. There is also involvement of the vital center in the medulla, which is manifested by irregularity in the rate and rhythm of respiration, and also there is cardiovascular alteration, include increase in the blood pressure and also development of cardiac arrhythmia. Paralysis of one vocal cord أيضا ممكن يصير. This is cause hoarseness of the voice or aphonia or asphyxia. كلها هذه المانيفستيشن of bulbar poliomyelitis اللي هو involve extraocular muscle, facial muscles, muscles of اللي هي pharyngeal muscles والpalatal muscles. As a result of this راح يصير عندنا absent of coughing, accumulation of pharyngeal secretion. This is affected inability to swallow smoothly, وممكن راح يسوي لنا paralysis of the vocal cord, which characterized by hoarseness of the voice or aphonia. حتى نسوي diagnosis of polio مثل ما قلنا polio is important disease. The presentation مالته inform clinical presentation. الباراليتيك بوليو ب3 أيضا clinical manifestation اللي هو spinal paralytic polio والبلبر polio والبوليو encephalitis. بالنسبة للdiagnosis in suspected cases of acute flash paralysis, we need to take 2 stool specimens should be collected 24 to 48 hours apart if the diagnosis of polio is suspected. Poliovirus can be isolated from a stool sample, especially during the first week after the onset of paralysis. Other investigation, we need to do a CSF aspiration. CSF initially is normal, but with involvement of the central nervous system, there is changes and abnormality in the CSF appear. Inform إذا شفنا ال CSF cell count راح نشوف increase بال cell count توصل تقريبا إلى 20 إلى 300 cells, mainly these cells are lymphocyte. If we did do a protein of the CSF, there is also an increase in the level of the protein to about 50 to 100 milligram. Other diagnostic method, we can use serological test for diagnosis of polio, and there is an increase in the antibody titer during acute phase of the illness and 3 to 6 weeks later. Treatment of poliomyelitis, there is also no specific antiviral treatment for polio, and the management of polio is usually supportive. For abortive polio اللي هو قلنا يصير عندهم fever, malaise and headache, we can use analgesic, antipyretic and good nutrition and bed rest. For those with paralytic polio اللي هم قلنا ممكن يصير عندهم spinal paralytic polio, most patients required hospitalization with complete physical rest. Suitable body alignment is necessary to prevent skeletal deformity. Moist hot packs may relieve muscle pain and spasm, and we encourage proper diet and high fluid intake should be started. If permanent paralysis of the limb occur, This may need skilled orthopedic device and regular physiotherapy. احنا قلنا يصير عندهم asymmetrical paralysis. ممكن هذا paralysis involved usually the lower limb, leg. فهذول البيشنت إذا بقى هذا paralysis عندهم without improvement احنا نحتاج إلى regular physiotherapy to improve the function of this involved part with the paralysis of poliomyelitis. إذا صار عندنا bulbar poliomyelitis اللي هو قلنا involved the muscle of the pharynx and palate and involves extraocular muscles and muscle of mastication. فالتريتمنت راح يكون maintain the airway and avoid all risk of inhalation of saliva and food and vomitus. We need to do frequent suction for the nasopharyngeal secretion. We need also to give the patient intravenous fluid and electrolyte. Close observation should be done for the patient for respiration. يعني احنا قلنا راح يصير عندهم irregularity in the rate and rhythm of respiration, and we need frequent monitoring of the blood pressure of the patient. Some patient may need tracheostomy because of vocal cord paralysis, وقسم منهم يحتاجون إلى mechanical ventilation because of abnormality in their breathing. As you know, polio is a preventable disease. Prevention راح يكون by proper hygiene measurement. As we said, it is transmitted by fecal-oral route by contaminated food. So it is important to encourage the patient to improve their hygienic measurement. Other way for prevention of polio is by vaccination. As you know, we have two types of vaccine in polio. اللي احنا نستعمله هو oral polio vaccine اللي هو live attenuated vaccine given orally to the patient. وعندنا other type of vaccine اللي هو IPV اللي هو inactivated polio vaccine. Both vaccine, the IPV والoral polio vaccine have established efficacy in prevention of poliomyelitis. Okay, that's the end of our lecture today. أكو رابط مع الحضور بس تسجلون أسماءكم. Is there any questions please?
لا دكتورة الظاهر لا ماكو أسئلة.
احنا دكتور اتفقنا وياكم انه ان شاء الله يوم الأحد راح يكون عندنا كويز بسيط الساعة 3.
تمام دكتورة إن شاء الله.
إن شاء الله يعني بعدكم نفس الوقت.
إن
شاء الله يوم الأحد الساعة 3 العصر. ما يطول هو فقط 10 دقائق وإن شاء الله كلكم تجاوبون. شكرا جزيلا. Thank you for your attendance. إذا ما عندكم سؤال.
تمام دكتورة مع السلامة.